Hello, everyone. I'm here to talk to you today about our Health Force Health Course startup company. Over this past year, the global community has been focusing on the COVID-19 pandemic. Everyone has had to deal with the new normal, from social distancing to masks to remote learning to working from home. Everyone has had their own unique experience with COVID-19. However, despite dealing with the same pandemic, not everyone has had to deal with the same set of problems. Systemic health issues in the United States have been evident for a while now. However, COVID-19 has shown how bad they are. These marginalized groups in the United States have had worse access to testing, higher incidence rates, higher death rates, and poorer access to overall care. For example, in Chicago, the Black community makes up only about 30% of the population. However, they account for 60% of their total deaths. On a more national scale, there are 249 total counties in the United States that have more than 5,000 Black residents. In all but 14 of those counties, the Black incidence rate of COVID-19 is higher than that of the white community. It's clear that there are vast issues with our healthcare system. However, with it being a multi-trillion-dollar industry, we ask ourselves the question, what can we really do about it? And this is where our Health Force Health Course startup comes in. So the idea of this startup is to provide kids with foundation for a brighter future, providing kids with the knowledge and information how to deal with the healthcare system, how to have healthy diets, how to see a doctor, how to operate healthcare insurance, and how to interact with the complex healthcare system will provide them foundation to live a healthy life in the future. Targeting these disenfranchised teenagers will help provide them with skills and tools that they need to live healthy lives and to improve their overall health outcomes. It is well known that the habits that teenagers form are lifelong. So targeting this age group is going to help provide them the best possible chance to live bright, healthy, and successful futures. Ultimately, we believe that providing them with these outcomes will help improve their overall health status in the United States and provide a preventative measure rather than a reactive measure to deal with improving their health status and improving their overall health outcomes. And now I will take a step and pass it on to Paul.
Thank you, Grant. Now, as Grant mentioned, I'm going to briefly go over what our competition looks like in the nonprofit space, and more specifically, what our competition looks like in the nonprofit space targeted specifically at youth organizations. Now, this table I have here has the top 100 nonprofit youth organizations in America that are, only focused on youth. So as you can see, there's really only 7 in the top 100 that are focused on youth development. Of those 7, there's really only 1 that is focused, partially at least, on youth health, and that's the YMCA. Now, to me, this is very important to observe because it proves that there really is a need for a program like Health Course on a national scale. So, as Grant briefly touched upon, Health Course is quite unique. We take a very unique and innovative approach at looking at health. So first off, we're looking to establish an all-encompassing health guidance platform. We're looking to be that one-stop shop for students that they can go to with any sort of health need. Additionally, we're looking to provide a source of consistent mentorship to our students through our virtual and in the classroom meetings on a monthly basis. Lastly, our program is specifically tailored to teenagers. We're not focusing on all children, but specifically teenagers. Looking at other, our competitors out there, especially in the nonprofit space that are also targeting youth health, we'll see the YMCA, and that was on the previous slide. So the YMCA is actually the nation's largest youth development nonprofit program. So the YMCA is really focused on 3 things: youth development overall, social responsibility programs, and also healthy living programs. So now within their healthy living program, they're really only focused on encouraging communities to develop long-term healthy living behaviors, specifically eating correctly, so nutrition and exercising. Well, this is absolutely great, and truly the YMCA is really a great resource for our youth and the community overall. Specifically, their health program is only tackling one small sector and really the larger health equation that we're looking to address with Health Force Health Course. Another competitor out there is Childcare Aware. So Childcare Aware is a nonprofit organization whose mission it is to make sure that no child in America is left without health insurance or health care. So they look to help children and their parents really navigate the health system and ensure that they have health care. Well, this is an absolutely great resource, and I believe it's a resource that with Health Force Health Course we will work with. It's just an example of one of the resources that we look to work with in tandem with and connect our students with through our Health Force Health Course larger platform. Furthermore, temporary medical school programs. So what we saw is we identified there were plenty of smaller local volunteer programs, mostly by med schools, that they targeted youth health. Med students would go in for info sessions or often practice physicals on the students and just checkups and some sort of preventative medicine best practices. But what we identified is that these programs really varied from school to school and were quite inconsistent, somewhat of a temporary fix at the problem. So with Health Force Health Course, we're looking to really establish a consistent national curriculum and program for mentorship and health guidance for our students. Lastly, CDC programs. Now the CDC is another great resource that we'll also look to work in tandem with in Health Force Health Course. But the CDC, while they do have a couple of initiatives and programs, they're usually for a set period of time. A resource that the CDC has that is really useful is their research and the articles that they publish on their website. So through Health Force Health Course, we'll look to connect our students to the research they provide. The CDC doesn't do in-person or virtual meetings like we look to do. So we're looking to better connect our students with Health Force Health Course. With that, I'm going to pass it over to Josh, who's going to go over our marketing plans. Thank you.
Thank you, Paula. I'll be discussing the marketing plan through the 4 Ps. Product. Health Force Health Course is our product and will be made available through an education seminar service at the school level, as well as an online education platform made available for free through our website. Health Force Health Course focuses on 3 key deliverables. First one being health and wellness, which aims to lead students to develop long-term healthy behaviors through daily actions to boost their immune system and maintain good health. Topics here include nutrition, exercise, hygiene rituals, adequate sleep levels, and mental health and wellness. Preventative measures include topics like doctor's visits and annual checkups, blood tests, and general medical and insurance information. Lastly, our Navigate Health system will serve as a resource to guide students through the healthcare system and information on insurance provider help, medical and healthcare resources, and to connect students to other resources and recommendations regarding general health and wellness, like nutrition and diet, exercise routines, and perhaps even an app to help them clear their minds and sleep better. Price. Health Force Health Course is a nonprofit organization offered for free to students and their families, and we rely strictly on donations to cover the cost of operations and future initiatives. We plan to gain sponsorships, grants, and fundraise for donations. In year 1, we plan to operate across 20 high schools, and we forecasted budget expense, including SG&A, which includes 5 administrative employees, each at the $50K average price range per year. And we plan to utilize volunteers, particularly medical students, to help work as representatives and counselors to the students and their families at the school seminar level. We're also forecasting a PR and advertising budget of $50,000 and a technology and equipment spend of $30,000 in year 1, giving us a total year 1 operating expense of $330,000. Sponsorships. So we plan to partner with like-minded brands to serve not only as a sponsor, but a resource to our students and their families. We broke these sponsorship levels down into 3 tiers. Title sponsorship is tier 1. These are $100,000 per year, and we hope to gain one of these per region. Examples of companies that might want to be a title sponsor include an insurance company or a local hospital. Tier 2 sponsorships may be made up of medical supply companies or public health organizations. This Tier 2 will be at the $50,000 price range, and we hope to gain 1 to 2 of these per region. Tier 3 sponsorship will be made up of CPG brands, supplement companies, and also could be made up of medical supply companies. These will be at the $10,000 price range, and we hope to gain 2 to 3 of these per region. Our annual regional sponsorship goal is $200,000, and our year 1 sponsorship goal needed to execute the program across 20 high schools is $400,000. Benefits to our sponsors include sponsorship donation certificate for tax deductions. As mentioned, we are a not-for-profit company, and so all of their sponsorship dollars will be tax deductible. A potential increase in business as a featured resource partner, and an increase in brand promotion through our seminars, websites, and more. We will allow for products and service promotion at the end of our seminars, which may include, if a company is it's a multivitamin gummy company, they're allowed to sample their products perhaps with a coupon at the end of our seminars, and the students could try it, and they could use the coupon to purchase more to help keep their immune system healthy. And it's a win-win because it also helps drive traffic to the company's retail channels. Sponsors will also receive recognition among community for supporting a good cause. We will feature our sponsors on our website, not only as a sponsor, but also listed as a resource. All title sponsors will be mentioned on PR and advertising throughout the year. Place. Our goal is to focus on high schools in low to middle class and high minority areas. Our year 1 goal, we will focus on 20 high schools spread across Dade and Broward counties, predominantly focusing on 9th graders, and we will offer the health course and monthly seminars for 1 hour each throughout per classroom throughout the school year. We will also offer our health course digitally through a free education platform and resource center made available online through our website. Promotion. So we will reach directly out to the select schools we hope to partner with, and we will advertise digitally through social media throughout the year to drive awareness and national demand. We will also utilize PR to amplify our message, and our goal is to gain mentions in good press articles and throughout local news channels. We will also partner with local ambassadors, particularly professional athletes and local musicians that really relate to the students to help drive the message of health and wellness and preventative measures home. Taoran is going to discuss the finances with you. Thank you very much.
Okay, thank you, Josh. Next, I will introduce our financial plan to you. This includes revenue, expense, and how we finance. As you can see, we plan to raise a total of $1 million in the form of fundraising and debt in first year. Among them, 75% will come from fundraising and 25% will come from debt. Fundraising mainly came from sponsors and donors. Also, we expect to have a 50% market growth rate for the first 4 years. First, our financing method is somewhat different from other companies. Nonprofit organizations have no equity in the company's capital structure. Therefore, we cannot raise funds by issuing shares, but only by issuing debts. We have some advantage over other companies in issuing debt. Due to our creditor do not need to pay any taxes to IRS when they receive interest from us. The interest we pay is relatively lower compared to ordinary companies. Compare a company like Starbucks, IBM, they would pay about 6% and we pay about 4%. So the cost of issuing debt is lower for us and will help us expand sooner. Secondly, for nonprofit organization, fundraising is our income and asset. We expect that the sponsorship fee will reach about 80% of the total income, and the donation will remain at about 20%. Since nonprofit organizations have no equity, all other liability and are net asset. So our strategy is investing each year to increase our asset. The income from investment can also help us to repay our debt. In the long run, as the amount of investment increase, it will also reduce companies' dependence on fundraising and enhance the company's ability to withstand risks. Next is expense. General and administrative expense is the largest part of our expense and will remain at about 80%. Also, fundraising is an important income source of our company. We will hold fundraising activity to help us to get more funds. This expense will increase by 40% every year, account for about 8% of total. Nonprofit organizations are exempt from federal and Florida state income tax. So the tax law has greatly increased our disposable income. Then in the end, we expect our expense has increased by 35% each year, which is slightly lower than 40% increase of our revenue. We want to keep the revenue and expense at the same level as possible. So thank you for your attention. That is our STAR plan, and we are the health force.
Thank you, Tyran. So I hope you can see that Health Course is truly a necessary program in our marketplace. Please, if you have any questions or concerns, feel free to reach out to myself and the rest of the team. Thank you.